The last grouping of special tests we need to go through are going to be tendon tests specific to kind of the fingers. So that's what we're going to be focusing on right now. The first two that we're going to talk about don't actually really require any type of resistance or mobilizing. You're essentially going to be observing. You're going to ask them to do something, you're going to observe it. So the first one is going to be the flexor tendon avulsion test for jersey finger. So our typical indication for wanting to do this test is going to be if they had a pop in the finger, or if their finger got stuck in the jersey. So they were, up against somebody, they had their fingers tucked in, and she took off with my finger still in her jersey, right? So it's going to cause that type of mechanism. What you're going to do is you're going to have them make a fist, right? And the positive test is going to be that whatever finger was injured, instead of it being tucked in nice like this, is going to stay out. They're not going to be able to flex it in, right? So that's going to be the positive sign, is that they can't flex in their DIP. And that's going to indicate to you that they have a rupture of the flexor digitorum longus muscle. The second tendon test we're going to do is the extensor tendon avulsion test for mallet finger. And this is going to be a pretty common mechanism. It's going to be a ball hitting the tip of the finger. If they have a lot of pain and swelling, it's going to indicate to you to do this exam. Again, all you have to do with this one is have them extend their fingers, right? Nothing too crazy. Extend your fingers. The injured DIP is going to be the one that will not extend out. So it's going to be in a flexed position while all the other fingers are extended. That's going to indicate to you that there is a distal phalanx or an extensor digitorum avulsion happening there. Both of those are going to require them being referred on to make sure they're getting proper splints or if they need to have surgery because of it. So making sure that you can recognize what those are. And again, the person's going to come up and say something's wrong, and their finger's either going to be flexed or it's going to be extended, and it shouldn't be, they're going to basically give you what you need for that. The third test we're going to do is the Finklestein test, and this is going to be for the de Quervain's disease. This is going to be regarding our thumb tendons, our thumb musculature. And the test for this is simply having them put their thumb in their hand, right? Close the fist. And so we've got a closed fist there. And then you're just going to have them ulnar deviate. Okay? That's all you have to do. And this can be positive non-pathologically. So even if you're just doing it, in your room right now, you're going to be able to feel kind of that pulling on those tendons, right? But with people who have the de Quervain's disease, it's going to be really painful. They're not going to want to do it. They're not going to hold it very long. It's going to signify that tenosynovitis of the extensor pollicis brevis and the abductor pollicis longus muscles, which is de Quervain's. The trigger finger test is going to be one that is probably not very common in kind of the collegiate level person. It's a little bit more common in your elderly population, although it can happen. So what they're going to typically present to you with is they're going to say that they have a catching or unable to extend their fingers. So if they're in a fist and they try to extend their fingers, they can feel either catching or they can't do it at all. They may even say too that they can feel some sort of nodule in there. So all you would simply do is locate where they're having the issue, see if you can feel a nodule in there, and then you're just going to simply have them extend their fingers. You should be able to feel that palpable nodule. There may be clicking, there may be popping in there, and that's going to tell you that there's probably some sort of flexor tenosynovitis in there. It may even be an issue with the pulley system. If you remember the pulleys in the fingers and the collateral ligaments, they kind of keep all of those tendons where they're supposed to be to prevent that bowstring phenomenon.